as we start dancing with these peptides and walking closely with you as more and more of my patients are looking for optimization on top of their lifestyle modifications, what they eat, what they don't eat, how they move, how they exercise, how they handle their stress, sleep, all the things. I think it's just been really fun to be a part of this thing.
Welcome to MyMD Unscripted, where healthcare gets personal and the script gets tossed. I'm Dr. Clint Carter, ER doctor turned direct primary care freedom fighter, on a mission to challenge how our healthcare system treats patients in America. In every episode, my expert guests and I dive into real conversations about what's broken and how we can fix it by making healthcare about people, not just managing disease. It's time to rethink what healthcare should be and how we can make it better together. Welcome to the podcast.
Hello and welcome back to MyMD Unscripted. I'm your host, Dr. Clint Carter, and today is part 2 of our peptide series. Last week, I went over what is a peptide, and we talked about metabolic peptides like weight loss and growth hormone. And so as a quick review, obviously if you missed that, go catch it. But, a peptide is basically a small protein. It's, 40, maybe up to 60, but really 40 or less amino acids folded up into a small protein, which we call peptide. A big protein may have hundreds or thousands of amino acids, and they get all rolled up into a ball. And sometimes what we give as a peptide is really just that corner of the protein that sticks out and does things. So the way your body works is your body has DNA, which is uniquely you, which then when turned on makes RNA, that when it does its job, it makes a protein, and that protein does things. So when a certain DNA segment gets turned on, usually oftentimes based on lifestyle or, what's going on in the body, it's called epigenetics. How we take, whether we exercise or not, turns on and off different DNA segments. If we're eating healthy, if we are taking in a lot of junk and chemicals and things that your body doesn't know what to do with, that turns on and off different DNA segments, which make different RNA, which makes different proteins, which do different things. And so what we're talking about here are small proteins that do things in the body that we like. They either tell the body to stop doing things we don't like or tell the body to start doing things we do like, but ultimately it's a signal, right? It's a signaling protein. It's a messenger in the body. Every cell in your body has, for the most part, every cell in your body has testosterone and estrogen receptors. Every cell in your body literally has thyroid receptors. So hormones send signals to everywhere. It's a broadcast of information, which we like. We want healthy hormone balance to tell the body to work well, which in turn is going to help turn on and off different DNA segments as well, which is going to result in different proteins being made that do different things. In our case here, peptides are small segments of proteins or small proteins that are more like a direct text message to a certain part of the body telling it to do a certain thing. It's a very specific purpose. Now, sometimes a specific purpose has multiple downstream effects, like we talked about the weight loss shot, semaglutides and tirzepatides of the world. They are very specific, but they talk to the brain, they talk to the gut, they talk to the liver, the insulin receptors in these cells. And so it's a very specific response, but it's, your body makes semaglutide or something very similar to it. And it's a part of the body's natural response to when you eat, where it should be. And so we gradually walk up on those doses and get you close so that when you eat, your body goes, whoa, I'm full. And all these things start to happen. And we talked about the pros and the cons of that. So today, we're going to get into a little bit more about some other peptide options that are out there besides, everybody knows about the weight loss shot. Not everybody knows that those are proteins, but everybody knows that the weight loss shot is a thing. And once again, they're shots. Most of these peptides are shots because we want the protein to get in the small protein, the peptide, to get into the bloodstream intact, whole, so it can go do its thing. If you swallow protein, it tends to get broken down into individual amino acids, and then the body just turns it into something else later. So We need to eat protein to give the body the amino acids that it needs to do stuff. And that's a huge part of, in fact, if you're not doing that, you don't need peptides, right? You need protein. And then eventually when we get where we're starting to make some better decisions and we're giving the body what it needs to heal, and we're exercising to our capabilities, and we're, managing our stress as able, and we're focusing on getting healthy sleep and all of those things, then peptides are a fun next step. And so one of the things that happens when you're out there exercising to take care of yourself or not, injuries happen to everyone, is injuries. And so, um, injury recovery can look like rest. It can look like, anti-inflammatories sometimes. It can look like physical therapy, chiropractic care, bracing, and external support. But one thing that all of those are counting on the body to be able to heal itself. We're helping the body heal itself. We're strengthening the part of the body that's going to help protect that injured area while it heals itself. We're going to increase flexibility of that injured area while it's healing so we don't lose our range of motion. But ultimately, the body heals itself. So one thing that we have found is that there are a couple peptides, the two that we're going to talk about today, that help the most with a specific injury. Obviously, yesterday we talked about increasing your body's natural growth hormone secretion. That's going to help injuries in general, as far as growth hormone is important for recovery and healing and energy. But these two options are BPC 157. It's ultimately derived from a stomach peptide. It's got good early data on rapid healing when put under the skin in the area of an injury. So these things work great for superficial injuries, things you can get to. So, a stress fracture in a runner, an ankle sprain, a tendonitis, hand injuries, elbow injuries, things like that. If you tear a meniscus in your knee, there's a limit. It's hard to get to that, right? I can give you a shot. You can give yourself a shot under the skin, but is that really getting into the deep part of the knee? Probably not. So there's a limit to that. My kiddos have, my youngest daughter currently is getting over a PARS injury, an injury to the bones in her back from just having an extra curvature to her spine, and probably PE coaches pushing them too hard in the weight room. But the idea is, like, I'm giving her some of this stuff under the skin, close to that. I'm not counting on it getting all the way down to those bones in the back and making a big difference. But you know what? The muscles and tissues around that spine are also affected and getting negative downstream signaling from the injury and the inflammatory and the nerves that are involved in this. So it's still doing her some good and hopefully healing her. So there's BPC 157. And then there is thymosin beta 4 is a thymus hormone. You may not be familiar with the thymus because you haven't had a thymus since you were like 10 or 12 years old. And thymus, kids are born with thymuses, and they produce, it's an immune organ that secretes thymus hormones, which are proteins that help kids bounce back from injury, help them not get sick, help them bounce back from illness. And then around puberty, the thymus just dissolves away. And it's basically, most of the time you can't even see a remnant of it on an MRI. But what happens is you get older and all of a sudden you get hurt, and it takes a lot longer to get better, and you get sick and it kicks your tail like it didn't used to. And your kid gets the same illness and they like bounce right back. And it's just, like, man, if I could bottle that up. Well, we kind of can a little bit. So BPC 157 and thymosin beta 4, there's a small section of thymosin beta 4 specifically works great for tissue remodeling and, cellular communication. It's called TB 500. So TB stands for thymosin beta. And so TB 500 is a section of thymosin beta 4. More information than you cared about, but you're going to hear both of them used interchangeably. So there is you can put these two peptides together, and the companies that are compounding this and put them together, it's come to be known as the Wolverine. So in Marvel Comics, the Wolverine character heals instantly. He can get shot and the body just pushes the bullet out and heals right up. And so it's not quite that dramatic. However, you can do daily shot of BPC and TB 500 together. There's strong animal data that this is going to cause significantly more rapid, more complete healing. Obviously, there's plenty of human data. There's high-level trials going on right now. It's used quite a bit for, anecdotally with with great results with functional medicine providers. It's not a research grade peptide. This is a human grade peptide that there is still probably some data to be established as far as like how much benefit you're going to get, how fast. But I have found that in my folks that are training for marathons and triathlons and things like that, where they tend to get a lot of overuse injuries. And these are great for overuse injuries. You can do it for tennis elbow. You can do it for a stress fracture. You can do it for a muscle strain, because those are all fairly superficial and you can get to them pretty easily. And these are just painless sub-Q under the skin injections. And so that has been really fun. It's not a replacement for rehab or physical therapy or, surgery in the right situation. But if you've got one where the surgeon's like, yeah, I mean, we could go in and fix that, but we could just, put you in a boot and, let the body heal itself. Well, this would be one of those where you go, yeah, let's not do surgery. Let's do the boot or the brace or the PT or whatever it is you recommend. But I'm also going to get from my direct primary care provider some Wolverine to inject into that sucker on a daily basis. So that one has been really fun to have. It's a small protein that does something. These are human. God created these peptides to do things. And then what we're asking for them to do is do a little bit more. Going back to the thymus for a second, the next segment that we want to talk about is like revving up the immune system, things that are going to help protect you from getting sick, help you get well faster when you are ill. And the main one of those is called thymosin alpha. We talked about thymosin beta with recovery. Well, thymosin alpha is very specifically thymosin alpha 1 it helps with T cell modulation, which T cells are a part of your immune system for fighting off illness. And so it's used, outside this country, it's used pretty regularly for viral illnesses. Obviously, it's getting growing traction inside the United States. In our practice, we have different options when you get ill. You can come in for an immune boost IV. You can come in, we got glutathione and B vitamins and C and zinc and fluids and all the things. Or you can come in for a quick injection of an immune boost and a B complex. And then if you really want to go big, we give you a shot of our supply of thymosin alpha. And so that we call that the triple threat. And so you get a single dose of thymosin alpha 1, which is helpful. Probably would be even cooler is if every time we got sick, everyone had already had a bottle of thymosin alpha 1 at the house that you could just start going with every day or twice weekly use. I know I had an autoimmune attack on my spinal cord called transverse myelitis. And so when that was going down, I got on thymosin alpha and there's a twice a week dose. And so I just went with the larger dose twice a week with that, as well as some of these neuroprotective peptides we'll get to. And, I'd like to think it had a big role in how complete and how quick my recovery was, along with lifestyle modification and all the other things that were going down at that time. But thymosin alpha 1 it's part of the reason that young kids with under the age of 10, when they get sick, they tend to bounce back really fast. There's another sort of immune peptide that's specifically antimicrobial. There's things called biofilms, that are, mold and toxin related and other things. But ultimately, it helps break down the bacteria's defense, or even, viral, but really bacteria specifically, and some fungal. It helps break down that bacteria, that cell wall, that defense mechanism, the biofilms involved, so that your immune system can knock them out better, or if you're on antibiotic, for the antibiotic to work better. But part of the reason these things thrive and can cause disease so well is they have over time built up these defense mechanisms to protect them from our immune system's attack. It either helps them hide or it helps them resist. And so, you can get a pneumonia that your body knocks out quick, or you can get a pneumonia that, lasts forever. Or if your immune system's weak enough, you get a pneumonia that's the last thing you get. And so things like this one is called LL37, specifically used for bacterial post-viral syndrome. So if you get a cold and you get a sinus infection, you get a cold and you get a bronchitis, any immune dysregulation where you need extra help knocking these suckers out. It's not as widely used as thymosin alpha, but it has a lot of promise, and it's getting a lot more use. I think it's compared to an antibiotic, it's more expensive and more cumbersome. However, there are situations where it's perfect. You've had a lot of antibiotics, you're trying to avoid antibiotics, the side effect of antibiotics with gut health and yeast infections and just, all the things can really be kind of a mess. The other thing that I took as I transitioned here when I had that autoimmune thing on my back was I took C-Link and C-Max. And so these are neuropeptides, brain and nerve protection and healing peptides that interestingly are not shots like everything. Almost every other peptide is an injection, but C-Link and C-Max are nasal sprays. And so the nasal spray is another way for it to get absorbed into your body without getting digested first. I think it also helps some proximity to the cribriform plate in some areas, but ultimately these are able to get past the blood-brain barrier for inflammation. They help with sleep, they help with thinking, they help with brain and spinal cord inflammation. And so I like to do, C-Max in the morning or C-Link at night or vice versa. I've got some people that like one more than the other. I've got one patient whose wife had it for one thing and he was taking it and it was helping him with his sleep. And so, he needed his own bottle. So the way that these things C-Max tells the brain to release more BDNF, which is, brain derived peptide or protein in your brain area that helps with stimulating your brain to make more nerve endings to grow and heal and connect. And so it helps with like cognition and the ability to think. It would be a perfect combination with the ExoMind device that we have here, which also stimulates BDNF. But the C-Link tends to be more along the lines of anxiety, sleep, has more of a GABA influence and your mental state in a more positive position with a healthy balance with GABA, but certainly anxiety for sure. I've had mixed results with these. I think it's hard for people to do nose sprays if you're having to do it twice daily. It's one of the main reasons I have people with terrible allergies that don't like to do Flonase. They're like, I just can't. I don't like it. I just can't remember. So I think making sure you get it from a good source, follow with it. And then if it doesn't get the result that you're looking for, then it might not be the one for you, but it's certainly a cool option, especially for someone that's struggling with anxiety and or sleep and or cognitive decline. And especially people who don't like needles, they come in super handy. Another section of health that is obviously super hot is gut health. The solution to gut health is plethora, right? So what you eat, what you don't eat, what you take as far as supplements, what you don't take, antibiotics, bacteria overgrowth, probiotics, prebiotics, fiber. The gut health conversation is one that never ends. We've had so many cool guests talking about gut health, pre-gut, post-gut, liver and bile, and all of the things that go into leaky gut and bacterial overgrowth and all those things. And it can just be kind of overwhelming. One thing that I've really enjoyed is the BPC 157 that I mentioned when we talked about the Wolverine and tissue repair that's given with a shot right over the injury. Well, it comes in an oral form. And I said it was gastric derived, right? So it's stomach lining derived. And so your body makes it anyway. But if we give you more BPC 157 orally, well, it doesn't help your ankle sprain much when it's taken orally because it gets broken down and used up in the gut before it really gets to the ankle. That's why we do shots at the injury site. However, orally, BPC 157 is super helpful at closing the gaps in the leaky gut syndrome, at healing the gut lining, at balancing your microbiome. I've got a couple patients that we're working on getting some functional testing for the gut health, but clearly leaky gut and or small intestinal bacterial overgrowth or SIBO. And BPC 157, while we're waiting on the opportunity and the finances to do some of that other stuff, has started making a pretty big benefit. Now we're also working on what they're eating. We're doing prebiotics and probiotics, a little bit of fiber, treating the gas and the bloat. But the BPC 157 is making a big difference all by itself. So it's really helpful as we move into some more direct therapies there. Related to the GLP-1s is GLP-2 analog, which is like tetraglutide. There are some things that it can help with as far as the gut health as well. I don't have a lot of specific experience with that one, but getting into that category with the GLP-1s and the weight loss versions tend to cause GI side effects because it slows the gut and does those things. It doesn't hurt the gut, but I don't know that I would think of it as gut health. So having a GLP-2, which is probably how the body balances that, that's promising as we go forward as well. Another area that's fun is, for skin and hair, as we've branched and gradually launched Live, LYV, our sister company. It stands for longevity, youthfulness, and vitality, doing some wellness, some cosmetics. The one thing that they use a decent amount or we use over there is the GHK copper or GHK-CU. Why CU means copper, I'll never know. But this can be used topically on the skin or in the area of the hair, and it can signal the body to make more collagen, turn back on some of the hair follicles, thicken up the hair follicles. It's certainly regenerative in the areas of aesthetics as far as skin health, the tissue under the skin, collagen, the HLA, the elastins, all those things. Especially you combine that with PRP therapies and exosome therapies. It's just a cool time to be in this field where for so long your only option was paralyzing the muscles until it was time to get a facelift for those that cared. And now the opportunity to be healthy from the inside out and have your skin as well as the tissue under the skin heal itself from the inside out with the help of these peptides that are signaling the body to do just that has been super exciting and fun to see and to be a part of. And to sort of be, along that first wave of introducing this to patient care, we're not cutting edge as far as like research is concerned, but we certainly have been on the front wave of most things wellness as we got out of the insurance game and realized there was so much more to taking care of people than what insurance likes to reimburse for. And certainly peptides are well outside of anything that insurance wants to reimburse for other than super expensive name brand, Manjaros and Ozempics, right? But there's just, what I don't like about them is their limited dosing availability. The cost is kind of outrageous. And, while having a pen to inject with maybe is psychologically easier and whatnot than drawing it up in an insulin syringe, it's no more comfortable. And so having the ability to micro dose, to change the doses week to week, and maybe you need to split your dose and take it twice a week because of side effects, or just go down on your dose in general and increase how frequently you do it. Maybe we shoot every 4 days instead of every 7, and all the things, right? So I just think that when it comes to peptides, I mentioned last time that we have a peptide management fee that we just apply every month as we start dancing with these peptides and walking closely with you as more and more of my patients are looking for optimization on top of their lifestyle modifications, what they eat, what they don't eat, how they move, how they exercise, how they handle their stress, sleep, all the things. I think it's just been really fun to be a part of this thing. I think what you have to watch out for fly-by-night clinics that are going to prescribe you whatever you want without a lot of monitoring, without a lot of lab work, without body composition testing or whatever's appropriate for whatever peptide. And they don't follow you closely and give you timely instruction on, how to adjust these things unless you start complaining. So also where you source your peptide from matters. I don't know that I would trust every place on the internet that says they've got BPC 157 or any of these other ones, especially not the semaglutide and tirzepatides of the world. There's a lot of junk going around out there, contaminated or just straight lies that just don't have it in there. You need to know that when it says it's got 5 milligrams per ml of XYZ peptide, that it's really in there and that you can trust the dose. And then, these things are all a couple $100 a bottle, and a bottle's going to last you a month or two. And so it can be a little cost prohibitive. There needs to be a decent amount of benefit if we're doing that. No one wants to just spend a couple $100 to say they're on a peptide and hope it's doing something. You need to know that it's the right one for you, and that we can follow up and figure out whether it was ultimately the kind of thing that we should circle back and do again later, or keep doing, or switch to something else, or, however that works. So it's all a way to optimize your wellness and your health, how you feel and how you're going to feel in the future. If it's not making you healthier now and or healthier later, then what are we doing? Lifestyle is still the thing. There's really no point in coming and asking me about peptides if you're not working on the other stuff, if you're not interested in diet, exercise, stress, and sleep maintenance, then peptides aren't, they're kind of other than, an injury here or there and some weight loss help. I mean, they're kind of the sprinkles on the icing of the cake of health, right? Like, they are cool, and they're going to get more and more options and more specific and more data behind them, but they don't replace these other things. And so I think that's pretty much it on the peptide talk. Peptides amplify good biology. They don't overcome bad habits. They, in direct primary care here at MyMD Select and Live, our sister company, we can monitor, individualize, where the rest of the world's just following a protocol, or so much of the world is following a protocol. The fly-by-night places are just, sure, take it like this. That's what it says. Most people do good. What we want is to be able to walk with you and make sure that you are indeed healthier today and healthier tomorrow. So thanks for hanging out with me. Thanks for putting up with just my voice without a guest. And hopefully we've shed some light together on what peptides are, what they might be useful for in you. And thank you guys for coming along in this journey with me. And you guys have a great week. We'll talk to you all next week.
Thanks for joining me today on MyMD Unscripted. I hope today's conversation opened your mind and inspired you to imagine a better path for your health and therefore life. If you found value in this episode, be sure to subscribe, leave a review, and share it with someone passionate about transforming healthcare. Real change starts with real conversations, so let's keep them going. Until next time, stay well, stay curious, and never stop pushing for better.